up, so I'm going to just get the groove on that. Next up is Dr. M.D. Monirul Haque. He's an academic general practitioner and specialist in GP. He's an affiliate clinical senior lecturer with Deakin University at the Geelong campus of the medical school. He's going to actually share his thoughts on shortage of GPs in Australian major metropolitan
and all the entrepreneurs here. I have been asked to make it short and simple. So my topic is shortage of general practitioners in metropolitan cities, missed opportunities to train the overseas trained doctors in metropolitan area. So what happened? So some of us here may have friends or relatives who have overseas qualified medical degree, but they can't work in metropolitan cities. But there is shortage of doctors. So what's happening? So number one, so we need 11,000 GPs by 2032. But Australian medical graduates, they don't want to be GP. We have overseas medical graduates, they can't get into the metropolitan city GP practices to train themselves. Rural Doctors Association and Rural Regional Health Minister, they don't want overseas doctors to work in metropolitan cities. The legislation for district priority area does not allow overseas trained doctors to get training in metropolitan areas. So these are the factors where GPs are not getting produced by the overseas doctors. Although we have many doctors, they are eager to pass their exams, to get in the training program and to be GPs. Next slide, please. So what happened? The scenario has changed. Lots of immigrants have moved in many metropolitan cities like Melbourne. But COVID came and it hit everybody. And the doctors are also hit. Many things happen, doctors are tired. So this leaf, this part which shows a little bit pinkish, that's the fatigue of doctors. Next slide, please. So next slide would be why the doctors are fatigued. So number one, the numbers of patients has increased in the community because the shortage of doctors in hospital as well. There are many patients, surgery has not happened due to the COVID lockdown, so the GP has to see all these patients. There are more chronic pain patients, they are not getting enough treatment in hospital setting, so GP has to look after. There are more psychological problems. We have heard so many domestic violence, we have had so many issues after the lockdown, so you need doctors to look after them, to witness their problem, to support them, to channel them in the right place. Senior doctors are tired. So previous slide please, I will be quick, I promise. So next slide please. So GP visits are getting more expensive. You probably know now GPs wants money. Why? Fire affecting GP's practices. The patient has to wait into the GP surgery long. The staff costs are high. The staffs are expensive now. Less doctor being overhead cost increases to the practices. So we need doctors. Next slide, please. So the reason why we are not getting doctors in the metropolitan city, rural and regional doctors and Minister of Health and Rural and Regional area, they have put a moratorium to bring doctors into the city. They call it distribution priority area. So cities are not in distribution priority area. So overseas qualified doctors, they can't apply. They have to apply in the rural area. But many of the doctors here, they have children. They can't really leave the city. Their husband or their wife or their relatives works in the cities. So I'm recommending that most likely DPA needs to change to metropolitan areas in a specific suburb, not in a specific area. A suburb where more people has moved, more people has immigrated. So the classification has been developed by Monash classification, where it looks like the distance from the town to the hospital, higher the distance to hospital, more the doctor they can apply. But metropolitan city doesn't work. The population number has increased. They have hospital, but they need more doctors. So the classification of DPA needs to change. They also need to look at the data of the city council, which area of the city has got more population. So that populated area needs to get the DPA priority. Next slide, please. So what I'm recommending all these politicians and entrepreneurs to give pressure to the government that please change the moratorium to let this doctor to train into the general practices in the city. So it will do two things. It will reduce the shortage of doctors, and also it will help the Australian community to get GPs. But otherwise, how are you going to get it? So the government is not understanding that rural doctors are telling we need doctors in rural area, but you need to increase the incentives in rural area, and you need to open the metropolitan cities so we can produce doctors and they can go. So, and the metropolitan area has got more GPs, so they can train other GPs. Next slide, please. So the main doctors get trained is the Royal Australian College of General Practitioners. The Royal Australian College of General Practitioners does not give funding for the metropolitan colleges, metropolitan GP practices. So I'm already negotiating with GP colleges. So to open a fund or to open a consortium, so we can take more overseas trained doctors to train into the metropolitan general practices.